things. Sufficient rooms that can cater for families, students, and even different calibers of
We escaped in a beautifully serene and secured environment with ample parking space.
We offer a holistic environment where we have an adoration chapel, private rooms for prayer, we have recreational rooms, we have a garden where you can refresh yourself.
For general inquiries and bookings, contact us on 0795 779 507 or send an email to graceandcsisters@gmail.com.
Grace and Compassion Hostels and Guest House is one of the best facilities in Bungoma Diocese, Bungoma County, and the entire Western region. We have delicious meals, serene, prayerful environments, and I welcome you to have experience yourself. Karibuni.
Welcome to Grace and Compassion Guest House and Hostels, where serenity is a reality. Beatitude Girls High School, located in Maragua, Murang'a County, is a private secondary school that provides quality holistic education to students. This institution of learning has gradually proved to be a hub of academic excellence for girls.
The expectations are that the girls who will go through the formation here will come out here with the qualities of the kingdom of God.
The school is fully owned by the Catholic Diocese of Murang'a, but run and managed by the Incarnate Word Sisters.
To bring up these young girls, to educate them, to mentor them.
The school has earned repeat and recognition for outstanding performance in different academic fields.
We are 3 kilometers from the main road. This creates a conducive environment for the girls, and our vision also is to expand so that the school can grow and accommodate more of our girls.
Students receive an all-round learning experience, including co-curricular activities to develop their skills and talents. In a bid to accommodate girls from humble backgrounds, we offer favorable terms of payment that are affordable to all. For more information about intakes and entry requirements, contact us on 0706 73 5006 or 0720 72 4337. Send an email to cdmbeatitudesgirls2016@gmail.com.
This is Beatitude Girls High School! Yay!
Welcome to Beatitude Girls High School, Murang'a. We learn to love as we love to learn. Is this life reserved for only the smarter, the fastest, and the fittest? Not really. At Mapson's Educational and Counseling Institute, everybody is a winner. All you need is your creative ability. Choose your skill set from our wide range of highly marketable courses, which include plumbing, welding, leatherwork, and detergent making. We also offer training in hospitality, dressmaking, and catering.
This is a Christian-based organization. I am a staunch Catholic. That is not to say that I will not accommodate people of other faiths. I welcome anybody who wants to learn, as long as they respect my Christian faith.
We have adult support groups which provide life skills training and counseling to the divorcees, widowed, and single parents. Visit our offices located at Ruiru Town, next to Ruiru Nazareth Hospital, and secure admission in the ongoing intake.
whether you are poor or rich. The doors to Mapsons are welcome to anybody who cares to come in.
For details, write to the director, Mapsons Educational and Counseling Institute, P.O. Box 3837, code 00506, Nairobi, or call us on 0722 363 868 or 0739 892 556.
Security here is high class. Right behind here, there is a police post in the premises next door. They are only a call away. Then I have the CCTV, and with the internet, I'm able to monitor what is going on in my compound 24 hours.
Welcome to Mapsons Educational and Counseling Institute. Mapsons, we transform problems into great opportunities. Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordia Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordia Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
Good morning. It is a beautiful Friday morning, and as it is usual, we bring you this live discussion on health. We inform you more about health and different institutions that can offer you the best quality of services in different domains. Now, right now, we welcome you to this topic of today, that is maternity and delivery. And in studio I have a beautiful lady from Mater Misericordia Hospital who will be taking us through this talk. Now welcome, and let's get to know who she is and what she does. Welcome.
Thank you so much.
I'm happy to have you this morning.
I'm glad to be here.
Please tell our viewer who you are and what you do at Mater Hospital.
All right, so my name is Caroline Mololo. I go with Mololo. I'm a midwife by profession. I work at the Maternity Mater Misericordia Hospital. I've been there for over a decade now, and yes, I would say that it's been quite fun working in Mater, and especially in maternity ward, because I have a lot of passion in regards to mother and child and just everything that pertains to the mother, a pregnant woman delivering, having a very positive and good outcome from the mother and the baby.
All right.
Yes.
Wow. It's good to have you.
Thank you so much.
Now that builds the credibility because you are experienced enough to take us through this subject.
Yes.
And the passion is also there.
Yes,
I can see.
Yes.
Great. Now, last week we talked about maternal and child health, but we cannot conclusively talk about maternal and child health without talking about maternity and delivery, because that's where it all starts, right, Caroline?
Sure.
Great. Now, remember, we are live on all our social media platforms. You can get in touch, engage with us, send your questions, send your feedback on Capuchin Television Network social media platforms. That is YouTube, Facebook, and Twitter. You can also contact us directly by sending an SMS or calling our direct line 0717 424 866. My name is Sasha Elizabeth, and welcome. Let's get started. Now, before we go into details about the nitty-gritties and specifics about Mater Hospital maternity ward, could you please tell us what maternity is all about?
All right. So thank you so much. That's a question that so many people would ask. What is a maternity? What does maternity entail?
Yeah.
And maternity is just a big name that, if we can simplify it, is just to say that the mother comes and hopefully goes home with a very live, cheerful baby, and mother and child are all okay. So we have quite a number of things that we actually offer in the maternity ward, from monitoring a mother through labor, delivering the mother with skilled and professional midwives and even obstetricians who are around the clock, and also just mothers who are also going for cesarean section, because you realize we have both normal delivery and cesarean section. And so for those who also go through cesarean section, we are able to take care of them post cesarean section and even post delivery, and just to anticipate for any complications that can occur and try to salvage the same, because you want the mother and the baby to go home as safe as they came. Of course, for maternity ward, we also have different wards where we keep any mother who has complication in regards to pregnancy. So if someone has, for example, hypertension in pregnancy, cardiac issues, diabetes, we are still able to monitor these mothers. So I would say there's quite a range of activities that we do in the maternity ward. It's not just about going to deliver and come. It's all about monitoring, taking care of the mother, education, you know, just walking that journey with this mother. We can call it quite integrated. Yes.
Sure, it does. Now, at what point does this period of maternity start?
Okay. So I would say, as my colleague was here, Mudhiani, she's called Mudhiani, in charge of MCHC, Mother and Child. That is where the whole program actually starts. Because once you know that you're pregnant, then you're able to come to the ward just to do a rough, I call it shopping, because you need to be able to know where you want to deliver. Is it favorable for me? Do I want to deliver in the same bed that I was laboring? Do I want to go to a different place? Do I want a general ward? Do I want a single room? Do I want an en-suite? So all those services. So it's very important from the beginning. Once someone has realized that they're pregnant, they start looking for a hospital where to deliver. And so it is very important from that time that a woman would come to maternity ward, familiarize yourself so that you don't wait for the time you're having labor. You know, when you're having labor, it's quite a complicated time. You're thinking about pain. You're also very anxious about your outcome. And then you're thinking, did I choose the right place to go? So it's very important from the word go. Once you realize you're pregnant, you're actually in your third trimester, you start shopping for the place you want to go and deliver.
Oh, wonderful. I concur with that. Now, what specific or special services do you offer in that specific unit?
I would say for Mater Hospital, we've been quite lucky because we have been we've gotten the newest, can I say the newest technology and equipments which are around, and we are able to monitor mother and baby. The good thing about it is that with the modern technologies that we're able to monitor the baby intrautero. So the baby is still inside and we're able to monitor the well-being of the child. And we're able to see if the baby is having a distress, if the baby is being compromised, if there's a situation we need to stop. We also check the contractions and we are able to tell, are these contractions too much for this mother and that's why the baby is having a bit of a distress. We are able to see all these conditions and actually in a graphical presentation, and we are able to make judgment. So it is very important for us to do that because we can tell that at this point we need to make another decision. If probably we had started augmenting labor, that is putting a drip, and we see that the fetal heart rate are either increasing so much or decreasing so much, again, it will be able to tell that this baby is getting compromised. There must be an issue. So either we stop or we need to make another decision in regards to the management. Because again, what I'm emphasizing is good outcome for the mother and the child. The other thing I would say is that we have a very good resuscitator, very equipped and newest models of resuscitator. Well, in case a baby actually comes out not in the best favorable condition, we are able to resuscitate this baby. We are able to take care of this baby to the best of our ability until the end of it so that baby can actually pick up. Same to the mother. We have a very good delivery coach, which is equipped with everything. I would say our maternity is quite equipped with everything that we need in regards to just monitoring a mother and a baby. Yeah, so I would say the services are there. We also offer what we call epidural anesthesia because you realize, especially for maybe me, I'm older. Elizabeth, I think you're young. Really? So for the younger generation, sometimes they don't want to have pain during labor. And so for that reason, we have what we call epidural epidural anesthesia. And as long as you're able to talk to us and tell us early in advance that you want an epidural, we offer that. And so it's a painless kind of labor. Yes, it's a very painless.
You don't feel any kind of pain or discomfort?
No pain.
And after that?
Actually until delivery time. Even after delivery, we'll still give you painkillers. And so you have a painless kind of labor. It's just that probably you'll pay a little bit more, but you will have a very painless labor. So we have such offers. As long as you talk to us, we're able to plan for that. The other thing is that we also give painkillers during this time. We also offer partner. We actually really engage birth partner, so that you're not in labor ward alone. Because you see, the fear, the anxiety that comes with labor, sometimes it's quite much. So when you have a birth partner or you have someone who's walking with you that journey, then it becomes easy. Of course, you also have what we call Lamaze balls that can help you in one area or another, just to try and ease the pain during labor and make you as comfortable as possible. And as I've said earlier, we have quite skilled and knowledgeable midwives and obstetricians who are around the clock. So you will always have someone with you just to take care of you, teach you 1-2 things, breathing exercises. If they see you getting it out of hand, they'll keep you up to date with what you need to do.
Thank you, Mololo, for that detailed insight about the maternity ward. Now, how long does it take the hospital stay for normal and CS deliveries?
Okay. So that's a question that is normally asked very many times. I would say for normal delivery, as long as there's no complication, then within 24 hours is good enough. So we say no more than 2 days. So as if you have delivered today in the morning, tomorrow you're good to go. As long as the baby is okay, you're fine, you're able to cope very well with your child, you're able to bond with your child, there is no complication. You know, especially for what we call primary gravidas, or mothers who just deliver the first baby, sometimes it's a bit of a challenge for them. So we try as much as possible to walk that day, that 24 hours, to make sure that you're able to actually accept that now you're a mother. 2, you need to breastfeed. How comfortable are you with that? How is the milk supply? Because we don't want you to go home and become depressed, because you realize that postnatal blues and depression are quite real. So those are things that we really take care of. Now for cesarean section, we normally say not more than 4 days. As at now, actually on the 3rd day, as long as mother and baby are okay, you're good to go home. So I would say just 2 days not more than 2 days for normal delivery and 3 days for cesarean section.
So you actually advise new mothers on the best formula for breastfeeding?
Yes, we normally talk, as I've said, the journey starts from pregnancy. So by the time you come to us from antenatal, there's what we call the mother mentors. So people will walk with you and tell you on breastfeeding what is expected after delivery. How soon does your milk flow, especially for the ones who are just first-time mothers, because of the anxiety. You want to know, after my baby has been delivered, will I be able to produce enough milk? Will my baby be satisfied? I have not seen milk production yet. How is it going to come? So all those questions will be able to answer even as we walk with you. So immediately the baby is born, what has been known is once you put the baby on the breast, immediately after delivery, within the first hour, actually your body is sensitized to start producing milk. So it becomes quite easy, and the whole day that is what we're emphasizing. You know, breastfeeding, we check on the bleeding, we check on how you're coping with your child, and we're able to address those issues. So 24 hours is quite good enough.
All right. Now,
yes.
I know this is not part, we had not considered it in our questions, but someone just reminded me that there's this general concern about CS. People believe that some hospitals or some health institutions have commercialized it. What do you consider, or what determines if someone has to go through CS or normal birth?
All right. It's a very good question. What I would say is that for us, especially at the Mater Hospital, is that cesarean section has to be there has to be an indication, a medical indication. That means if the mother has a compromising situation, if the baby has a compromising situation, and as I've said, at the end of the day, we want the outcome of both the mother and the baby to be good, then that is at the point where we consider cesarean section. Remember, if you already have a previous scar or you have already been done a cesarean section, chances are the next delivery will probably be a cesarean section. And so for us, we try as much as possible that for the first delivery, it has to, we try to limit to a normal delivery, but not compromising the life of the mother and of the child.
Wow.
So that is what I would emphasize very much.
Now, could you please share with us the normal delivery package?
Yes. All right. So Mater Hospital has what you call the normal delivery package. You also have what you call the cesarean section package. For normal delivery package, as I've said, it's just about 2 days to be in hospital. You would want the baby to be seen by a pediatrician, so we offer 2 days a visit by a pediatrician, also 2 visits by an obstetrician, meaning that there's a midwife who's worked with you. You delivered either with a midwife or an obstetrician who is around. We have what you call in-house obstetricians who are around. Then we normally give painkillers that are required either during labor and even after delivery. Yeah, those are things that we normally offer. And again, just the checking up throughout labor and even after labor and delivery. So that is what we call now the normal delivery package. Of course, we also give a few handouts like basin, pads. We also give diapers. We also offer clothes. So you don't have to carry anything.
So you don't have to carry anything?
No, you don't have to carry anything. Just
if
walk.
I feel like I'm almost due, I just walk in and I'm in town. I happen to be in town.
Just come.
Okay.
Just come.
Okay,
yes.
great. So now
for cesarean section, we normally say 3 days. Again, it offers all the lab tests that are supposed to be carried out. That is blood grouping, checking your hemogram tests, urea and electrolyte. Those are all covered within the package. Then again, I've said 3 days visit by obstetrician and even by a pediatrician. Now, in case there's any complication or anything that may warrant or change this, then we may need to cross over and you may have to top up a little. But within the package, we would have worked with you during antenatal period and told you that now you're fit for a package and we actually consider you for package.
Thank you so much, Mololo. Now, quite an interesting talk today. Yes. So now, if you are in labor pain and you happen to be somewhere around Mater Hospital, main hospital or satellite clinic, you can just walk in and everything will be sorted from there. We take a short break and we'll be right back with more on this. Stay tuned.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services to include consultation services which are done by our qualified and experienced doctors.
We manifest the spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologies.
Get more than just basic treatment at Mater Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to Mater Misericordia Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the Mater Misericordia Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.
Welcome back. This is our talk today, being a Friday Health Talker, and as you can see on your screen, we are delving deep into maternity and delivery. And in studio here, I have a very beautiful lady who is really experienced in the field of midwifery, and she is the unit in charge of the maternity ward at Mater Misericordia Hospital. Remember, you can give your feedback, as I mentioned earlier on our social media platforms, Capuchin TV, YouTube, Facebook, and Twitter, and you can also send SMS or your feedback on our line, that is 0717 424 866. Now, as an expectant woman, there are some red flags, some complications that usually arise, or you might feel like there's something that is not normal. So we would like to know more about the red flags. What are some of the most common complications, the telltale signs that will show you that this really needs attention, and how to go about them. So, Caroline, yes. Welcome back to our second session. Yes. Please take us through these common complications in pregnancy.
Okay. So thank you so much, Elizabeth. And we have quite a number of what we call complications in pregnancy. However, I will just highlight on 3, which are quite common. And one is what we call hypertension in pregnancy. And when we say hypertension in pregnancy, we are basically saying that your pressure has gone high. So when your pressure has gone high, then it means that even your baby is not getting enough nutrients, your baby is not getting enough oxygenation, your baby is not getting enough blood supply. And so for that reason, it puts the mother and the baby in a very compromising situation. Now, with hypertension in pregnancy also comes with what we call preeclampsia and a very bad complication, we normally call it eclampsia. When you're just having a high blood pressure or a pregnancy-induced hypertension, it means that you have, we call it gestational hypertension. You have never had high blood pressure throughout your life, but because of the fact that you're pregnant, your pressure suddenly starts misbehaving. And so you have incidences of where your pressure is going up. Now with preeclampsia, it can occur again due to many reasons. Probably if I have to dive into the risk factors, there are quite many. One I would say is just a fact that you're a first-time pregnant woman. It already puts you at risk for you to have either hypertension or what we call preeclampsia. Now preeclampsia, you're having high blood pressure, but again you're also having swelling either on your hands, on your feet, and most of the time on your face. And because of that reason, your body is also emitting what we call proteins. And so in your urine, when we check, because that is a check we do every time we come to the antenatal clinic, we shall see that there's protein in your urine. And so that gives us now a distinction between now the pregnancy, hypertension in pregnancy, and the preeclampsia. Now eclampsia means you already have the preeclampsia, the pressures are high, you're having swelling or fluid is being retained in your body. And for that reason, when we check also your urine, we have protein. But because your body is already put in a certain compromising situation, then you end up having fits. You know, jerky movements and fits. It's like you're convulsing. Yes, and so those are very serious conditions or complications of pregnancy, and they arise majorly because you are pregnant. Now, do we have treatment for this? Yes, we do. And that's why we say, as the moment you realize that you're pregnant, you need to come to the hospital so that we walk that journey with you, so that in case there's any deviation from normal, we are able to actually take charge as soon as possible. You'll be put on medication. Most of the time after delivery, this condition tends to wear off. Of course, sometimes after delivery, there are people who actually develop now what we call chronic hypertension, because probably the condition has not subsided after pregnancy and it has still continued even after pregnancy. Yes, you wanted to ask something?
Yes, you mentioned something. Maybe before we move to the next complications, you mentioned about swellings.
Yes.
And some people have created that mentality that swelling, especially of the feet, is normal during pregnancy. Is there normal swelling, and how do you tell the difference if it exists?
There is what you call normal swelling, because again, with the growth of the uterus, then it blocks the blood vessels that are flowing from your legs coming up. So you tend to have a bit of fluid retention on your legs. But if you put your legs if you elevate your legs, like let's say you're in a seated up position or you're lying down and you elevate your legs, by gravity the fluid is supposed to go back. So it tends to wear out or to clear after it could have come because you were just sitting for so long, or you've been walking for so long without taking in breaks, but after you sit down and elevate the legs, actually it clears out. Now remember that what we are saying is for preeclampsia, it is not just swelling of the feet. So you're having swelling of the feet, swelling of the hands, swelling of the face. You're also having high blood pressure. So when we check your pressure, it is very high. When you check your urine, it has a bit of protein. Of course, sometimes not all these signs will actually be there. We call it a cascade. Probably it will not all be there, cardinal signs. But at least 2 or 3 of these signs, if they're there, then we call it preeclampsia. Eclampsia, I've told you now you have all this, but now you're fitting or you're having convulsion.
All right.
The other thing I would say is diabetes. Diabetes is very common, and again in pregnancy we call it gestational diabetes. That means you have never had diabetes all your life, but for the fact that you're pregnant, it puts you in that position to get diabetes. So we check your sugar, we find it is very high. During pregnancy in our antenatal clinic, we do tests for sugars. It's called O'Sullivan test. Now, if the O'Sullivan test is high, it shows the sugar is high, then we go to what we call OGTT, and it is oral glucose tolerance test. So we are trying to see how your body is tolerating. We give you some glucose, and we see how it is being synthesized in your body, and how much is still remaining in your body, and we are able to say if you're having a glucose intolerance or you're developing what now we call gestational diabetes. Now, the people who already have diabetes, so you've been, probably you are checked at some point and you're told you're diabetic, so you're already on treatment. Now, you'll still say you have diabetes in pregnancy. Now, again, for these who are having gestational diabetes, if we don't take care of our nutrition, we don't take care of, exercise, we are not losing weight, we are not managing our drugs, we are not taking our drugs as actually we've been told, then we can end up with now actually diabetes mellitus type 2. So you did not have diabetes, but because of the mere fact that you're pregnant, you've gotten the gestational diabetes. Because it has not been taken care of, we end up with now diabetes type 2. Now, the complications of this is that the baby is normally compromised. And one of the most significant things is either you'll have a stillbirth or a preterm delivery. Yeah, so your baby, because already the condition where the baby is staying, it is not favorable. So the baby has to be gotten out. And most of the treatment, one of the major treatment that we actually do is actually to deliver the baby. So that now we give the baby a chance to grow, and we also give you a chance as the woman now to take care of that disease. So I would say diabetes and hypertension is quite significant as complications, and of course bleeding. And again, with bleeding, it may come due to several issues. We could be having a low-lying placenta, what we call a placenta previa. We could have a placenta that is detaching before time. We call it placenta abruptio. Again, we could be having fibroids that are bleeding. You could have an injury, yeah? So those are some of the things that can actually lead to bleeding in pregnancy. And again, any bleeding that occurs, it means that the baby's life is definitely going to be compromised. And of course for yourself, because if you're bleeding, it means that you're losing out a lot of fluids. You can't go to shock, which will actually damage even your heart, because your heart now is trying to compensate for all these mechanisms that are happening.
So do you have some remedies for all these complications, especially bleeding?
Now, for bleeding, I would say if it is due to a low-lying placenta, what we call a placenta previa, then we normally advise for bed rest. Sometimes we may have to actually keep the mother in the hospital for a period of time, because we do not want you to go and do any exertion, any activities like carrying very heavy things from the floor, anything that will exert any issue. So you may have actually to be admitted for some time in the hospital and just continue with bed rest. At the same time, we can also advise you go back home but do your bed rest. Now, if it is due to a detaching placenta, what we call now placenta abruptio, if it is actually, most of the time, if it is during third trimester, we tend to deliver the baby, because that is the best treatment that can happen. Now, sometimes there could be fibroids which are there, which are quite severe. We may actually have to go to theater to remove the fibroids. But again, as I've said, it is all dependent on the stage that you're in and the severity of that condition.
So if in case you have to remove the fibroids, do you first have to remove the baby?
No.
Okay.
Yes.
All right. Now, there are some complications that are common in pregnant women. Are there some, let me say, lifestyle practices that could predispose a pregnant woman to such complications? Or rather, what are these best practices that a pregnant woman can embrace to make sure that herself and the baby stay healthy until delivery?
Yes, very important. And for lifestyle is quite key, because what we normally say is how you handle yourself will actually determine the outcome of yourself and your baby. Now, we normally say weight reduction, especially from the word go, preconception, even before you start getting pregnant. If you can start controlling your weight, if you can start controlling your diet, what you're eating, because we know that you need to have what we call a balanced diet for you to have a healthy baby and yourself. Even for the growth of the baby's cognition and you know, just the mind, it is very important to know like which foods you're supposed to actually take. So working with a nutritionist is very important. Just seeing a gynae from the word go and being seen or being followed by a midwife is very important. Because you're able to do your weight check every time that you come to the clinic, and we'll tell you now your weight has increased so much, we may need to cut on something, we need to check your diet and see what could it be that you're eating too much, or what is it that is causing all this. Again, as I've said, we also do tests which will tell us, is it that now you're getting into diabetes? Are we having diabetes? That is why your weight is actually increasing, or that is why you're behaving in a certain manner. So lifestyle conditions, I would say, of course, obesity puts people at a very high risk in regards to almost all the complications. Being just a first-time pregnant woman puts you also at risk. Those are things which are so inevitable to us. But at the same time, if you do your early clinic, you work with a nutritionist, you work with your gynae or a midwife, you'll be able to tell in case of any deviation, and we're able to streamline.
Wow.
Yes.
Now, thank you. So, in terms of the red or danger signs, what is a pregnant mother supposed to do?
Well, that is very important, and I think I can't get out of here without talking about danger signs. Now, danger signs are things that when they happen when you're pregnant, you should be on the fastest way to get to the hospital. That is why they are called danger signs. Now, we have also what we call minor conditions that occur when you're pregnant, like sometimes you're craving for something, sometimes you call pica, things you want to eat, you know, stones and all those things. Those are minor complications. Sometimes you may have a bit of nausea and vomiting. Those are things we can say those are minor complications. But when it comes to danger signs, it means that these are things that definitely will put your baby at risk and yourself. Now, one of the major danger signs that is very important to any pregnant mother to know is that you could be having a reduced fetal movement. So your baby has been playing very well throughout pregnancy. Then at some point you do not feel your baby playing. And I normally tell mothers myself that if there's anything that is almost predominant to you as a woman is to check the fetal heart rate. To check the fetal movements, because I can check the fetal heart rate and tell you the heart rate is okay, but movement is quite peculiar to you because you're the one who knows the rhythm and the pattern of how your baby has been playing. So if you see there's a deviation, my baby used to play very many times, right now I don't feel the baby playing, those are things that should take you to the hospital very fast. Now, the other thing is bleeding, which I have already talked about. Bleeding is not a common thing. It is not a normal thing. So any bleeding that occurs needs to bring you back to the hospital. The other thing I will talk about is severe headache. You're having headaches which are very persistent and they're not going down. It's probably in combination with the swelling I've talked about, either swelling on the face, on the hands, on the legs. You're also having epigastric pain. So you're having a lot of pain on your epigastrium. It is very important for you to come back to the hospital. Again, you could be having dizziness episodes and actually fainting. So you're not just dizzy, but you're also fainting. Those are some of the things that really have to bring you to the hospital. You should not even think twice. The other thing I would say is now draining of liquor, or if your waters rupture at any time. It is very important for you to come to the hospital. Remember, during third trimester, sometimes you might have some urine going down, but when you have actually liquor that is draining, it will flow to your legs. And so that will tell you that there's something that is wrong. So anytime your water breaks, please come to the hospital.
Thank you, Molola. Now our time is up, but could you please briefly, in a few seconds, tell us which is the best mode of delivery, and tie that with someone asked, are they offering the services across all Mater hospitals or at the main hospital only? This is Jane from Thika.
All right. So when it comes to the question of whether normal delivery or cesarean section, I do not want to bite my tongue. Mm-hmm. What I will just say is that at the end of it is good mother, good baby, positive outcome for the mother and the baby. Mm-hmm. Of course, I would advocate for normal delivery because, again, as I've said, if your first delivery is cesarean section, almost always the next delivery will be cesarean section. So if we can prevent the first cesarean section, then it will be of good help, but not compromising the life of the mother and the child.
Thank
yes.
you. Now, could you please respond to Jen's question?
So for Jen's question, we have all antenatal clinic, which we offer in all the satellite clinic. Mm-hmm. But for the purposes of normal delivery, then it is at the main hospital in South Bay.
Okay.
Yes.
All right. Thank you so much. Caroline Mololo, you are today focusing on maternity and delivery. And remember, this is powered by Capuchin TV in conjunction with Mater Misericordia Hospital. Every Friday we have a health talk here just to inform you and give you the important information that you need to know. This is a very broad medical field, that's maternity and delivery, and the one that we touched on last weekend, on last Friday, that is maternal and child health care. Now at this point, my director says our time is up, and of course the team on the other side at Thika, they are already prepping up to go on air for the funeral rites and burial of Sister Marie Therese of the Assumption Sisters of Nairobi. Yesterday we had the Requiem Mass, and today she will be laid to rest. May her soul rest in eternal peace. Now I'd like to thank you, dear viewer. What really struck me is the epidural pain relief, and of course the fact that I can just walk out, I'm in my own errands, and then I happen to be in labor pain, I can just rush to Mater Hospital and everything will be sorted. So at this point I would like to call it a day, and of course I cannot do that without giving credits to those who are working with me behind the scenes. And today our visual mixes have been Clinton China and Prudence Rimba, our sound engineer Kevin Kitavi, and our camera person Christopher Odhiambo, and on the transmission desk as usual we have Peter Mwangi. Thank you so much everyone for the concerted efforts that you have affixed to ensure that this one is fruitful and of course successful. Thank you Mater Hospital team, thank you Capuchin TV team, management and administration. See you next time. My name is Sasha Elizabeth. Goodbye.
Mater Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to Mater Karen Clinic or Medical Center is because we offer a variety of medical services, to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist.